Done, sir.
So, good afternoon, everyone. The topic given me is as now the COVID cases we are getting the day by day now. So, the role of the Molnupiravir in the COVID management. I am Dr. Abhijeet Khandelwal, Professor, Department of TB and Chest, Index Medical College and Research Center, Indore. So, the Molnupiravir is not a new drug. It's in the market since like 1.5 years. So, which we are going to discuss in the next few slides is the role of the Molnupiravir in the management of the COVID-19 pneumonia. So, the topic which I am going to cover is on the introduction, the virology of the COVID virus, variant of concern, geographical distribution, and transmission, virus life cycle, and Molnupiravir and clinical trials. So, first question is what is SARS-CoV virus? So if we introduce the coronavirus are important human and the animal pathogen. At the end of the 2019, a novel coronavirus was identified as a cause of the cluster of pneumonia cases in Wuhan, a city in the Hubei province of the China. It's a rapidly spread, resulting in the epidemic throughout the China, followed by an increasing number of cases in the worldwide or in the other countries throughout the world. So the coronavirus virology, if you ask me, that the coronavirus are the RNA virus. These are the envelope positive sense single stranded RNA virus size is the 80 to 220 nanometer in diameter, with the largest RNA genome reported till date. So what are the different variants? Then we are getting the lot of the news. Sometimes the Omicron, sometimes the Delta, sometimes the Beta one. So like the other virus, SARS coronavirus evolving in a time, the most mutation is the SARS-CoV-2 genomic have no impact on the viral function. Certain variants have garnered widespread attention because of their rapid emergence with population and evidence for the transmission or clinically implication. These are considered variant of the concern. So the variant of these include the Delta B lineage. This lineage was first identified in India in December 2020 and since had been the most prevalent variant worldwide until the emergence of the Omicron virus. So second is the Omicron. This variant was reported from the Bostazna and very soon therefore from the South Africa. In South Africa, it was associated with the in the regional infection, and now it is promptly identified in the multiple other countries. Immune evasion, according to the limited data, Omicron appeared to escape humoral immunity and be associated with the higher risk of the reinfection in the individual previously infected with the different strain. Severity of the disease, some data have been interpreted to suggest that the risk of the severe disease with the Omicron infection may be less than the other variant, as especially like the Delta variant, where we get the more severe infections. So this is the usual experience of the possible Omicron cases by Indian physician. Fever has been the common feature, usually mild, and goes away in the next 2 to 3 days. Scratchy throats or the sore throat is common to all and the mostly the problematic. Weakness generalized quite common for few days. Headache is predominant symptom, sometimes very severe. Body ache is almost half of the patient and stay for the couple of days in the most cases. Few patients had the severe backache. Most cases the CRP and the D dimer are within the normal limit. Oxygen saturation is hardly affected in the Omicron virus. Respiratory distress is rare. Mostly are asymptomatic by 4 to 6 days. Productive cough could be the distinguished feature from the Delta, which presently with the dry cough usually during the second wave. Loss of smell and taste not being found so far. Atypical symptoms like night sweats, diarrhea has been also been reported. highly infectious as whole family contacts are getting infected, at least presenting with the some symptoms. So the geographical distribution, you can see the global situation, confirmed cases are near about 18 crores, 35 lakh 60,151. In about that, the 39 lakhs are deaths. This is a source from the WHO. Data may be incomplete for the current day or a week. So how it transmit? The route of the person-to-person transmission directly via the physical contact between an infective individual and a susceptible individual, which you call infector and infectee. Indirect via the contact with the contaminated surface or object like the fomites, and directly through the air from one respiratory tract to another via the large respiratory droplets and via the fine respiratory aerosols. This is the cycle of the virus. Virus entered in the host cell, binding the receptor subunit. Conformational changes in the viral spike protein penetration, viral and host cell membrane fusion via the H2 subunit of the spike protein receptor. Clarithrine indicate mediated the endocytosis, entry of the viral nucleocapsid into the host cell and the release of the viral content, viral RNA replication, transcription and the translation, protein biosynthesis in the cytoplasm and the release of the new viral particle, transportation of the newly formed viral protein via the Golgi vesicles to the cell membrane, and exocytosis to the extracellular space, which lead to release of the new infective material for community transmission after the penetration and the maturation. What are the available treatment options for the SARS-CoV? As per the R.T. Gandhi study published in the New England Journal, so the treatment across the spectrum or the as per the severity disease pathogenesis in the COVID-19, mild, moderate, severe, and the critical classification. Mild, the constitutional symptom like fever, dry cough, fatigue, no shortness of breath. Moderate, the shortness of breath with the exertional. O2 saturation is more than 93%. Severe, the shortness of the breath at rest. O2 saturation is less than 93%. Respiratory rate is more than 30 per minute. Critical, the respiratory failure and the organ dysfunction failure. The viral inflammation, we have the antiviral, monoclonal antibody, anti-inflammatory. And limitation of the current COVID-19 therapies are the monoclonal antibody are indicated for outpatient and mild to moderate COVID-19, but have the significant limitation. Parenteral administration, clinical monitoring needed during the infusion and for more than 1 hour following the infusion. Hypersensitivity reaction, potential to become the less effective to emerging SARS-CoV-2 variants. Remdesivir require the intravenous administration and the only approved for the treatment of the hospitalized patient. There is no adequate approved oral antiviral agent available in the treatment of the patient with mild to moderate COVID-19. So the Molnunot introduction is the Molnupiravir interrogation. It is also known as the EIDD 2801 MK4482 is a product of the active antiviral ribonucleoside analog, the beta DNF4 hydroxycysteine. Molnupiravir has been shown to be effective against infection caused by the variety of the RNA virus. Molnupiravir is effective in the highly pathogenic coronavirus and influenza virus, as well as the encephalitic alpha virus such as the Venezuelan, Eastern, and the Western equine encephalitis virus in the non-clinical models. So the molnupiravir is the oral product of the N-hydroxycysteine and it is a substrate for the coronavirus RNA polymerase and exert in the antiviral effect in introducing the error in the vRNA which impair the SARS coronavirus maturation. You can see how it convert on the hydroxycysteine oral administered product rapidly converted to the esterase. You can see that the how it divide. So if you ask me the therapeutic indication, it is indicated for the treatment of the adult patient with COVID-19 with SpO2 is more than 93 and who have the high risk of the progression of the disease, including the hospitalization or death. So how it work on that the COVID-19 virus? It is a mechanism of action. It incorporated into the viral RNA. During the replication, you can go with that the diagram also. Proofreading function and the NSP14 exonuclease with viral polynucleotide fail due to the similarity in the nucleoside structure of viral RNA and molnupiravir. The Molunapiravir induced the error catastrophe during the replication lead to the impaired viral fitness and viral extension. Fatal flaws in the sequence, stop infection, stop replication, and it limits the transmission. So finally, it work on the replication of the virus. So the targets the RDRP increases the frequency of the viral RNA mutation and impair the replication of various virus, including the SARS-CoV-2 in animal mode and in the patient. Available data suggested that the molnupiravir act as a mutagenizing agent and causing the error catastrophe during the viral replication. Also, sequencing of the influenza virus population indicated that the molnupiravir causes the G to A and C to U transition in the viral RNA, and the same transition was found in the SARS-CoV-2 SARS-CoV virus. So this is in this slide you can see the incorporation and the mutagenesis, and you can see that the RDRP and the gRNA template, gRNA product, gRNA template, gRNA product, and you can see that the random sequence is shown with the M and the mutated residue indicated as the orange and the violet letter respectively. Molnupiravir genetic toxicology, the evidence of the in vitro mutagenicity, low risk of the genotoxicity in vivo, and it addresses a critical unmet medical nature. It is the oral ribonucleoside analog that potent inhibit the replication of the SARS-CoV virus. In the phase 3 trial, designed the endpoint agreed upon with the FDA enrolled non-hospitalization adult with the mild to moderate COVID-19, more than one risk factor associated with the poor outcome and symptom onset within the 5 days. As you can see that the benefit is confirmed in the supportive analysis in all randomized control trials with the primary efficacy analysis. Molnupiravir is an oral antiviral for the treatment of the COVID-19. Proposed intended use the treatment of the mild to moderate COVID-19 in adult with the positive results directly for SARS-CoV-19 viral testing, and who are the high risk of the progression to the severe COVID-19, including the hospitalization or death. The doses are the 800 milligram orally every 12 hours for the 4 200 milligram capsule for 5 days. No dose adjustment in the patient with renal or hepatic impairment. No drug to drug interaction is identified. It can be taken with or without food, and treatment should be initiated within the 5 days of the onset of the symptoms. So if you are using this after the 5 days, then it is having the limited use, limited actions. What are the limitations of the use? It should be used in adult only above the 18-year of old, for not the uses of the longer for the 5 consecutive days, for pre-exposure and post-exposure prophylaxis for the prevention of COVID-19. Pregnant ladies should not use. Women with the childbearing potential should be not used. Male of the reproductive potential should not be used. So recommended doses is the 800 BID for 5 days, can be taken with or without food, should be administered as soon as the patient tested positive. If the patient misses a dose within the 10 hours of the time it is usually taken, the patient should take as soon as the possible and resume the normal dosing schedule. If the patient misses a dose more than 10 hours, the patient should not take the missed dose and instead take the next dose at the regular scheduled time. The dose adjustment in the special population in the renal and hepatic impairment. Fortunately, there is no dose adjustment is necessary for the elderly patient or in the patient with renal and hepatic impairment. Lactation, the breastfeeding is not recommended. Drug interaction, no drug interaction were observed as per the available data. Adverse reaction, nervous system disorder, common dizziness, headache, gastrointestinal disorder, common diarrhea, nausea, vomiting. Uncommon is the vomiting. Skin and the subcutaneous tissue disorder, uncommon rash as the urticaria. Antiviral efficacy of the Molunapiravir is a significant reduction of the shed virus load you can see within the 12 hours. Infectious particle become the undetectable within the 24 hours of the starting of the treatment and completely suppress the release of the infectious viron into the nasal lavages within a slight longer period of 36. What is the treatment and the prophylaxis in the mice study? There is a significant effect on the viral replication in immune deficient mice implanted with human long tissue, and after 2 days of the treatment started 24 hours after the exposure of to the SARS-CoV virus. It is reduced the quantity of the infectious particle in the human lung tissue of the lung by the 4.4 log. Treatment was initiated 48 hours after exposure. Virus titer was decreased by 96%. No infection virus was isolated from any participant who received 400 or 800 milligram Molunapiravir 4 dose following the treatment. You can see on this the slide for the visit 1, visit 3, visit next day, there are the 53 participants, 54, 55, 22, 22, 22, 43, 43, 42, 52, 50, 53, and the doses of the 200, 400, and 800. Is the effect on the proofreading. It's the first method which shows to be evading the active exon for the proofreading. And the exon does not recognize targets or eliminated the Molunapiravir. Here you can see the viral replication in the ways other than the lethal mutagenesis. time to SARS-CoV-2 clearance of the viral RNA, greater proportional of the participants achieved SARS uh, by the end of the study in the 800 milligram Molunapiravir group compared with the 91.3%, 78.7%, 80.3% for the 200 and 400 milligram Molunapiravir and placebo, the group respectively. This is the move out trial, which is showing the Molunapiravir versus the placebo, and it shows the reduced risk of the hospitalization or death by 30%, reduced hospitalization, hospital admission or death across all key subgroup, effective regardless of the symptom onset, timing, and the underlying risk factor, effective across all variant. So if we go for the COVID-19 guideline, you can see that the guideline by the panel statement of the therapy of the high risk non-hospitalized patient with mild to moderate COVID-19. The purpose of this statement is to provide clinician and guidance on the use of the ritonavir boosted, Molunapiravir, Paxlovid, Sotrovimab, Remdesivir, and the Molunapiravir for the treatment of the non-hospitalized patient with COVID-19 who are the high risk of the progressing to severe disease. Molunapiravir is expected to be the active against the Omicron, although in vitro and in vivo data are currently limited. What are the NIH guidelines for the Molunapiravir in the pregnancy? The FDA EU states that the Molunapiravir is not recommended to patients due to the concern about the instance of the fetal toxicity and the animal studies. However, when the other therapy are not available, people with the COVID-19 who are the high risk of the progressing to the severe disease may reasonably choose Molunapiravir therapy after being fully informed of the risk, particularly those who are beyond the time of the embryogenesis. The prescribing clinician should document that the discussion of the risk and benefit occur and that of the patient choose this therapy. What are the NIH guidelines for the Molunapiravir in the women with childbearing potential? Patient with the childbearing potential should be counseled about the abstinence of the sex of using reliable contraceptive method for the duration of the therapy and 2 to 4 days after the receiving Molunapiravir. Reproductive toxicity has been reported in animal study of Molunapiravir, and the Molunapiravir may be mutagenic during the pregnancy. You can note down the things if you need it. I will go a little bit slow. Molunapiravir in man with the childbearing potential, man of the reproductive potential who are sexually active individual of the childbearing potential should be abstain the sex or the use of the reliable method for contraception for the duration of treatment for at least 3 months after the last dose of the Molunapiravir. This is a very good slide, and the screenshot I am taking from I have taken from one article that the symptomatic mild cases as per the definition and the comorbidity without pneumonia with the normal SpO2 without the vital sign normal and respective respiratory rate less than 24 per minute, age more than 60, diabetes, uncontrolled hypertension, CAD, COAD, immunocompromised state, CKD, CLD, obesity, on immunosuppressive drug, do blood test with the 48 to 72 hours, CBC, ESR, CRP, RFT, LFT, D-dimer, immunocompromised, X-ray, case-to-case basis. If the fever persists on the 5th day, it is preferable to get to the HRCT. For all the symptomatic patients, devote to time for the day 1, no steroid unless hypoxia, antibiotic as per the treating physician discretion, anticoagulation decision based on the severity of the illness and the risk score like the improved DD. The monoclonal antibody, if delta suspected, casivimab plus imidacimab If the Omicron suspected, only sotrovimab not available in India, budesonide inhalation given by the DPI or MDI with a spacer at the dose of the 800 microgram BD for 5 to 7 days and may be given if the fever and the respiratory symptoms are persistent beyond the 5 day of the disease onset or even the early in the high risk group. The antiviral within the 5 days of the illness, the Paxlovid, Lovid not available at present. Option 2, 3 days course of the remdesivir 200 mg IV on the day 1, followed by the remdesivir 100 mg IV daily for day 2 and 3, initiated as soon as possible and within the 7 days of the symptoms onset to those aged more than 12 years and weighing more than 40 kg. Molunapiravir at the 800 mg BD for 5 days and the favipiravir, the option is divided as per this choice. No data with Omicron apply your own discretion. You can see if you point if any missed. If we compare with the other available antiviral, the favipiravir with the molnupiravir, molnupiravir is having the high binding affinity. Day 5, the no infection virus could be recovered, faster recovery. Dosage is 800 mg BD for 5 days. Mild and manageable ADR, headache, insomnia, and ALT increases. Low binding affinity, day 4 to 70% with negative in Indian trial. Day 5, 62.5% were RT-PCR negative in another study. And the dose is here is the 800 mg BID, here is the 1800 mg oral twice daily, and first day followed by the 800 mg oral once twice daily up to the maximum of the 14 days. Hyperuricemia, ALT, elevation, and diarrhea. Salient features with the molnupiravir. The molnupiravir is the prodrug of the beta D94 hydroxycysteine and the inhibitor of the RNA-dependent RNA polymerase and the active against the SARS-CoV-19 virus. It is the first oral antiviral approved by the US FDA, DCGI India, Japan, UK Medicine and the Healthcare Product Regulatory Agency for the treatment to mild to the moderate COVID-19 in adult. In the phase 3 study by Merck, the molnupiravir significantly reduced the risk of the hospitalization or death by approximately 50% in a planned interim analysis of the move out trial in the risk non-hospitalized patient and adult patient with mild to moderate COVID-19. Molnupiravir demonstrated consistently efficacy across viral variant like gamma, delta, mu and likely efficacious against Omicron variant. Salient feature the molnupiravir. The 2 phase 1 trials has demonstrated that the oral molnupiravir is safe and well tolerated at the therapeutic doses. After 5 days of the oral molnupiravir therapy, satisfactory efficacious elimination nasopharyngeal virus in the patient with early and the mild COVID-19 were disclosed in the 2 phase 2 trial. The recently released the molnupiravir significantly reduced the risk of the hospitalization or death in the adult experienced the mild and the moderate COVID-19 to benefit individual and public health. Clinical application of the molnupiravir to promptly treat COVID-19 patient and prevent SARS-CoV-2 transmission may be expected. So the salient features are in the move out to a randomized placebo-controlled double-blind clinical study is molnupiravir for at the risk of the progressing to severe COVID-19, 18 year of age and the older, and had one or the more predefined risk factor for progression for 60 year of age, diabetes, obesity, chronic kidney disease, serious heart condition, chronic COPD. For the active treatment with molnupiravir, reduce the risk of the hospitalization or death at the risk unvaccinated adult with the COVID-19. Molnupiravir is not authorized for the use of the patient less than the 18 year of age for initiation of treatment in the patient requiring hospitalization due to the COVID-19 benefit of the treatment with the molnupiravir has not been observed in the subject when the treatment was initiated after hospitalization due to COVID-19. For use of the longer than the 5 consecutive days or pre-exposure or post-exposure prophylaxis for prevention of COVID-19, not recommended for the use during the pregnancy and the lactation period because of the fetal harms. You can, this is a busy slide, so you can go through it also. So the female of the reproductive potential, female of the childbearing age, advised to use a reliable method of the contraception correctly, consistently as the applicable for the duration of the treatment after the last dose of the molnupiravir. Male of the reproductive potential use a reliable method for the contraception correctly and consistent during the treatment for at least the 3 months. The female, it should be used 4 days after the last dose. In the male, it should be 3 months after the last dose. Quick reduction in the viral load, reduce hospitalization, 100% RT-PCR negativity on day 5, broad spectrum active against the all strain. So, Dr. Chah, this is all about the regarding the molnupiravir. So, if any questions or anything related to this, you can answer. Chahat, are you there?
Yes, sir.
So, if the slides are visible?
Yeah, sure, sir. It's visible.
So, overall, this is the all detail about the this. So, if you have any question, you should wait for the 4 to 5 minutes for any query. You can write on the chat box also. The session is the host Zoom link is different. The attendance links are the different. You can chat on the chat box or you can directly ask. This is all about related to this. on the last session, we will take a break of the 5 minutes and then we will discuss the vitamin D and association. Chad, please close this session.
Okay, sir.